Hello and welcome. My name is Christy Evanko and I'm a board certified and licensed behavior analyst. I'm here today to speak to you about the laws that pertain to behavior analysts and your responsibilities regarding them. This presentation is intended for providers and specifically behavior analysts, although anyone is welcome to view it. First, I want to start by saying that I am not a lawyer and I have never studied law. I'm a behavior analyst and I've researched and supported many of the laws that I'm going to talk about, but this presentation does not constitute legal advice. So if you have any specific questions, I recommend that you contact a lawyer. Today, I'm going to talk briefly about behavior analysis and autism. Then I'm going to discuss the history of ABA in the Virginia legislature, the regulations governing behavior analysts, including applying for and maintaining your license with the Board of Medicine. And then finally, I'll give a brief overview of some of the funding sources available in Virginia. So before talking about the laws, I want to call your attention to this map. And this is a map of licensed behavior analysts in Virginia as of April of this year of 2015. And you can see that there are concentrations in the North and Richmond and Hampton Roads areas, but there are quite a few behavior analysts out west as well. This map includes both LBAs and LABAs. And note that as of April 26th, there are 591 LBAs and 106 LABAs. Those are behavior analysts with license and include providers who live outside Virginia but practice here and thus have a license. Now, according to the BACB, there are 508 BCBAs, including Masters and Doctoral, and 87 BCABAs in the Commonwealth of Virginia. That's April of 2015. This next slide shows the growth of cases in autism spectrum disorder in the U.S. based on CDC data, and it's over a 10-year period from 2000 to 2010. Now, if you look at this curve, you're going to note that it's very similar to this curve. And it should come as no surprise to anyone that the number of behavior analysts in Virginia is growing exponentially. In 2014 alone, the profession grew from 400 to 600 behavior analysts. And there's nothing that indicates that this trend is slowing at all. So that's the current state of behavior analysis in Virginia as of April of 2015. Let's talk about the history of ABA in the Virginia legislature. There are four main laws that I'm going to be discussing that pertain to behavior analysts, and they include the 2011 Autism Insurance Law, the 2012 Licensure Law, the 2014 Advisory Board and Exemption Law, and the 2015 update to the Autism Insurance Law. For the most part, these laws were all sponsored by Delegate Tad Greason, who deserves our gratitude for being a champion for children with autism and for behavior analysts. So let's begin with the Autism Insurance Law, because that is really the law that started things for behavior analysis legislature in Virginia, as has been the case really in many states. According to Autism Speaks, 40 states have some version of autism insurance laws as of 2015, April 2015. 5 other states are actively pursuing legislation, and 5 states are not pursuing legislation at the moment. In Virginia, it took us about 10 years to get a law that would pass. Virginia Autism Project and Autism Speaks tirelessly advocated year after year and were finally rewarded in 2011. At that point in time, only 25 other states had such laws. So to be clear, the Virginia Autism Insurance Law requires insurance companies to pay for care for kids with autism when it is deemed medically necessary. Prior to this law, insurance companies could state that they did not cover autism. And if a parent submitted the diagnosis to insurance companies, there was a chance that the company would not pay for any type of service for that child, including ABA. Services now covered for children with autism include behavioral health treatment, pharmacy care, psychological care, therapeutic care such as speech, OT, and PT, and ABA when provided by a licensed person. So now in Virginia, kids can no longer be denied insurance coverage solely because they are diagnosed or receive treatment for autism. There were some caveats to this law. There was an annual dollar cap of $35,000 and an age cap of 2 to 6 years. In practice, this does not translate to every company in Virginia providing insurance for kids with autism. You may find that companies are exempt because they don't have enough employees to warrant the mandate. Or you might come across a self-funded plan that doesn't include the services, although many have elected to anyway. You might find someone who works for a company that is headquartered in a state without an autism insurance law. Those plans under the Affordable Care Act or Obamacare will also not be covered, most likely in Virginia. For information on what to do if a client's company does not cover ABA, see Autism Speaks website and click on Advocacy. I do want to quickly say that the exemption for self-funded plans was not a negotiation, but under ERISA, no state can place a mandate on those types of plans. Many of you might know that in Virginia, in 2015, Virginia Autism Projects and Autism Speaks went back to the legislature with Delegate Greason as our patron to remove the age cap from the 2011 law. Unfortunately, in order to get this law passed, we had to settle for increasing the age cap to age 10. This is still a significant win. The change is going to go into effect in January of 2016. Now, another change that was made to the law has to do with the federal law that is expected to change soon, and that law will raise the number of employees needed to still be considered a small company from 50 to 100. Therefore, in 2016, companies with 100 or fewer employees will be exempt from the mandate. Another change to the 2011 law that was not a result of passage of the 2015 bill is the $35,000 cap will most likely not be applied. There's a 2008 act called the Wellstone-Dominici Act that prohibits placing a cap on mental health benefits, including treatment for autism in Virginia, if there is not a similar cap on physical health benefits. Note that Virginia, unfortunately, does not specifically include ABA as a treatment in the Affordable Care Act guidelines, which is why it's not covered in this state, nor does it include autism within the state definition of mental illness. So it always seems that laws beget other laws, and that was certainly the case for behavior analysts. When the 2011 autism law passed, one of the amendments that Governor McDonnell added after the fact was one that stated that ABA must be provided or supervised by a licensed behavior analyst or a licensed assistant behavior analyst. There was no such license. Therefore, it was necessary for us to go back in 2012 and pass legislation that provided for a license under the Board of Medicine. This was a relatively easy bill to pass, and a working group was created consisting of 2 BCBAs, a BCABA, a consumer member, and that was me because I was not a behavior analyst at the time, a medical doctor, and a psychologist. Emergency regs took effect in September of 2012, and the first licenses were issued. Now, there was a slight pause in the spring of 2013 while the full regs were coming into play, but currently the regulations are in action. Now, Virginia is not the only state with a license for a behavior analyst, but it does seem to be the only state where the license is housed within the Board of Medicine. As of June 2014, according to APBA, the Association for Professional Behavior Analysts, 19 states have some sort of a license or state certification for behavior analysis. One of the things that was missing from the creation of the license was an advisory board. Now, this is standard practice with the Board of Medicine, and the BOM asked that we go back again in 2014 to add both the advisory board to help them regulate behavior analysts, as well as a student exemption for those seeking certification as a BCBA or a BCABA. Now, while that was going on, it was becoming apparent that the public schools were in violation of license regulations, as teachers and administrators often do functional behavior assessments and behavior intervention plans. It was not feasible to effectively squash interventions based on the science of ABA out of the schools. So instead, we created an exemption. This exemption is in no way intended to discourage those who are board certified and working in public or private schools from getting their license. It is only intended to cover those who are not board certified, but maybe using good reinforcement techniques or looking at the function of behavior. School employees are not able to practice behavior analysis outside of the school unless they are licensed, nor can they supervise anyone who is seeking certification. The board meeting, the first advisory board meeting, was in 2014, and the meetings are held quarterly and they're open to the public. So there are effectively 3 exemptions right now to the behavior analyst license law. The first one is really a standard exemption that was built into the very first time we passed the license law, and that's that our license can't preempt someone else's license. So if, for say, you're a licensed psychologist and behavior analysis is within the scope of your practice, then you are certainly able to practice, and you may hold dual licenses if you wish. Students is the second exemption. They may practice behavior analysis as long as they are receiving supervision and until they receive certification from the BACB. But once they have submitted their information to the BACB and are no longer being supervised towards certification, they must not practice until they receive a license. And I already talked about the school exemption. Now, this is not the end. For instance, Virginia Autism Project and Autism Speaks will most likely go back to the legislature in the future to attempt to remove the age cap entirely, as other states have done. There will also be other legislation that applies to behavior analysts in the future, I'm sure. You need to get involved so that you are shaping your profession rather than waiting for others to do it for you. You can do so by joining the Virginia Association for Behavior Analysis, or VABA, and this is the best way to be involved in shaping the profession in Virginia. As the current president, I can tell you that we are working on initiatives to allow for more involvement by those who are interested. So please visit the website today and become a member. Regarding the autism laws, you may sign up with either or both Virginia Autism Project or Autism Speaks to receive information on advocacy in Virginia as it happens. I strongly urge that you do this. Laws do not change themselves, and while delegates like Tad Greason and senators represent us, they need our help to let them know that what we need for our profession and for our clients. Sometimes changing the law takes time. Many conversations are held with legislators in order to convince some of the necessity of the laws. You can participate by meeting with legislators or writing letters to them. They do listen to us. Another way you can participate is by making public comment. Again, if you're interested in helping, please contact VABA. I'd like to switch gears a little and talk about these regulations that I touched on earlier, the regulations that were created through the working group when the license law was passed. First, please know that it is the responsibility of every licensed behavior analyst, and we call them LBAs, and licensed assistant behavior analysts, we call them LABAs, to be familiar with the regulations that govern them. I'm going to outline some key points in the coming slides, but I strongly urge you to read and become familiar with the regulations yourself. Now, I've listed the website where you can find them on the screen. It is the licensed person's responsibility to update the Board of Medicine if your address or other personal information changes. You can do that through the website. The fees for license are $130 for BCBA and $70 for BCABA. That initial license is going to last anywhere from 13 months to 2 years, and the reason for that is that licenses are renewed in the month of your birth and odd years. So if you apply for your license in April of 2016 and your birthday is in May, your renewal date will be May 2017. The renewal fee is slightly more expensive for BCBAs at $135, and the same initial fee for BCABAs at $70. Note that BCBADs are treated as BCBAs for this purpose, or is treated as LBAs for this purpose. The main requirement for initial licensure is board certification from the BACB. Technically, you do not need to maintain BACB certification for renewal, but it is strongly advised that you do. It is sometimes hard to understand why people who are newly certified must not practice until they receive their licenses, since there is not any extra requirement beyond certification, such as another board exam or an interview or anything. However, this is most certainly the case. Even a BCBA who has been practicing for many years in another state is prohibited from practicing in Virginia until he or she receives his or her license. I want to draw your attention to the updated BACB Professional and Ethical Compliance Code, and that's the newest code that will be in effect in January of next year, 2016. And that's the one that's quoted in this presentation, although it doesn't differ that significantly from the current one in effect. Now, number 1.04 integrity states, behavior analysts' behavior conforms to the legal and ethical codes of the social and professional community of which they are members. In other words, it is every behavior analyst's responsibility to know and obey the laws that govern us and our community. According to the regulations, the practice of behavior analysis is defined as the design, implementation, and evaluation of environmental modifications using the principles and methods of behavior analysis to produce socially significant improvement in human behavior, including the use of direct observation, measurement, and functional analysis of the relationship between environment and behavior, and supervision of licensed assistant behavior analysts and unlicensed personnel. This is how the law in Virginia defines behavior analysis. The regulations also stipulate continuing education requirements. Now, currently, the number of CEUs needed to maintain one's license is slightly less than what it is to maintain certification with the BACB. And this is because the regulations were written when the old CEU requirements were in effect. The advisory board is exploring changing the regs to update the requirement. It is important to note that all of the CEUs that are approved by the BACB are ultimately approved by the BOM, the Board of Medicine, but there are no current ethics or supervision requirements for the BOM. However, if you're following the standards set by the BACB, you're going to be fine for your renewal of your license with the BOM. Now, while the BACB has very specific information on the supervision of students, the regulation for supervision with the BOM are specific to the supervision of LABAs, of Licensed Assistant Behavior Analysts. It's really important to note that the licensed behavior analyst is ultimately responsible and accountable for client care and outcomes under his clinical supervision. Delegation shall only be made if, in the judgment of the licensed behavior analyst, the task or procedures can be properly and safely performed by an appropriately trained assistant behavior analyst or other person, and the delegation does not jeopardize the health or safety of the client. In other words, care being provided by an LABA or an unlicensed person under the direction and supervision of a licensed behavior analyst is ultimately the responsibility of the LBA, and it's the LBA license that is on the line. So with regard to supervision of LABAs, for the most part, following the upcoming 2017 guidelines for supervisors will be sufficient to satisfy the Board of Medicine. This slide and the following outline some of the differences. But at the moment, the BACB really only requires 1 hour of supervision of BCABAs per month. This is going to change to a minimum of 2% of hours that the BCABA is working at least once a month. There will also be a different requirement for the supervision of newly minted BCABAs. The BOM, the Board of Medicine, however, requires 1 hour every 4 weeks, and they require that the supervision is in real time, meaning live and person to person. The BACB will also soon require observation of the BCABA with clients on a quarterly rather than a semi-annual basis, although the BOM really does not have such a requirement. With regard to group supervision, the BOM allows for it and in their list of supervisory activities, so it's safe to follow the BACB guidelines. With regard to reporting about supervision activities, the VA BOM really only requires the initial contract. There will be increased reporting requirements for the BACB in 2017, and I strongly urge you look at both sets of regulations if you're supervising BCABAs or LABAs. Now, regarding the initial contract, both bodies, the BACB and the BOM, have somewhat different requirements, and they don't necessarily overlap. It will be important for supervisors and supervisees to be familiar with both sets of requirements and to create a document that satisfies both bodies, as well as meets the need for the individual parties. Following the BACB 2017 specifics and then adding a portion that discusses the domains of competency for the supervisor and thus the supervisee should do the trick. The nature of ABA itself lends itself to a tiered service delivery. And in the 2011 insurance law, which really started everything, it specifically states that ABA is provided or supervised by a behavior analyst. It is difficult for the BOM to address unlicensed personnel as their existence is bound by regulating licensed persons and not in policing those who are unlicensed. Nevertheless, the law does have a provision for tiered service delivery, and the supervision of unlicensed persons is written specifically into the regulation. You'll note that the duties of an unlicensed person, it states, must not constitute the practice of behavior analysis. As stated earlier, the licensed person is ultimately responsible for the care of the client. If you're looking for some light reading, and I actually suggest that you do, look into the other sections of the regulations. For the most part, following the 2016 ethics guidelines will satisfy the BOM and then some. Sections of the Board of Medicine regulations include confidentiality, client records, client communication, client termination, practitioner responsibility, referrals, sexual contact, and refusal to provide information. In another presentation, I actually did a very specific comparison of each regulation that was provided by the Board of Medicine to the ethics guidelines provided by the BACB. If you are interested in that comparison, you can email admin@virginiaaba.org or wait to the end of this presentation and there'll be my contact information. I'll send that to you. Now, one thing that many people may not realize is that as a healthcare provider, we are bound by HIPAA regulations. There are companies that provide presentations and resources regarding HIPAA and the sharing of information, and I suggest you look into it. You can also get a full HIPAA risk analysis for your business. I also wanted to touch on the extra regulations that apply to brick-and-mortar ABA clinics. VABA is currently looking into the state requirements for clinics in one of its subcommittees. The organization will provide summaries of findings, but in the meantime, one current recommendation for owners and operator of ABA clinics is to acquire a license through the Department of Behavioral Health and Developmental Services, that's DBHDS, in addition to their Board of Medicine license. You can see the website address for the application to that on this slide. And there have been reports of the state contacting some clinics recently and requesting that they acquire a daycare license. And that's quite different than an ABA clinic and has rules on napping, etc. So the safer thing to do is to apply with DBHDS, which can also license you. This next section is about applying for your license if you haven't already. The process is online and you can start and stop it as needed. VABA is actually working on a toolkit to help new applicants apply. It will hopefully be ready by the time this presentation goes live. For the last couple of years, VABA, and that's the Virginia Association for Behavior Analysis, has been sending out emails to new certificates with the support of the good people at the BACB and helping new certificates get their licenses. One helpful tip, as it often takes a lot of time to get the license, maybe a couple of months, is to apply at the same time you are applying to take the boards and then submitting your certification as soon as you receive it. So you can apply when you're applying to take your certification test through the BACB, you can apply for your license at the same time, put in all the information except for the certificate saying that you're a BCBA and add that later, and that will make it much more quick. It's going to cut down considerably on the time that it takes to receive your license. So you can feel free to contact me. Again, my information will be at the end of this presentation if you or your supervisees have any information or questions or need any help. For those of you who already have your license, this presentation is being given in 2015, and so it's an odd number year, which means that you're going to be receiving notices, if you haven't already, about renewing your license in your birth month. You'll probably get it about a month before. You're going to need to receive that notice because it's got a PIN number so that you can access the online renewal service. It's really easy to do, but if you don't have the PIN, you won't be able to renew. So if you don't receive it at least a month prior, contact the Board of Medicine. Now, it's important to note that the CEU requirement is actually waived for your first renewal cycle, and that, of course, has to do with the fact that some people it's 13 months and some people it's 24 months. So you don't have to worry about the CEU requirement matching up in the first renewal cycle. It would be subsequent renewal cycles. Now, one more bit of information that the BACB has asked me to pass along is that certificates should not alter in any way the identifying license, the letters of their certification. So that's BCBA, BCABA, or BCBAD. The credentials are trademarked, and it weakens the trademark if you change it. For instance, if you add a slash that says L, that's illegal. It's not to be done. So what you do is you list both your license and your certification, and you should put one after the other, separated by a comma. Now, you can definitely put one or the other if you'd like. It's up to you. But you may not alter the BACB trademark at all. Finally, in this presentation, I've received a lot of requests to discuss funding sources in Virginia, so I'm going to briefly touch on them now. But I highly suggest that you contact the specific sources for the most accurate information, as it changes often and it's very, very difficult. But the sources I'm going to discuss are some of the very common sources where you get funding in Virginia, and that's private insurance, TRICARE, Medicaid, FAPT or CSA, and public schools. So I talked earlier about the Autism Insurance Law and how it doesn't necessarily mean that a specific child is covered. And many of you know about the controversies regarding the new AMA CPT codes. Better people than I are working on this issue, and I suggest that you keep abreast of this information through APBA and ABAI. Now, VABA is going to endeavor to keep our members updated as well. You might, if you're a TRICARE provider, note that there are some recent changes with TRICARE insurance. If you spend some time on social media, you may have noticed several groups that have cropped up to discuss these issues. In this manner, providers are helping each other to navigate the changes. And that's a really great way of doing it because different people hear different things. You can also, of course, call TRICARE and talk to them about it. APBA and ABAI are addressing the issue with TRICARE as well. Now, we all know that ABA isn't only recommended for children with autism. So one way to get involved with a different population is through the ID and DD waivers. There is a service called Therapeutic Consult that differs somewhat from what many of us think as ABA services, but could be very valuable for many individuals on these waivers. So as things are written currently, the consultant does not provide direct services with the individual, but rather works with the individual's family and support staff. Applying to provide this service is easy. You can find instructions on virginiaaba.org. Another funding source that is similar but not listed on this slide is the Department of Aging and Rehabilitative Services, or DARS. This service is also very valuable to individuals, and behavior analysts are needed to help support individuals in their employment. For more information on how to apply, please email admin@virginiaaba.org. Recently, and that is the December of 2014, the regulations for delivering ABA through early and periodic screening, diagnosis, and treatment, or EPSDT, which is what most people think of as straight Medicaid, has changed. It is now much easier for LABAs and LBAs to become Medicaid providers. It used to be that providers of what is called outpatient ABA were licensed by DBHDS specifically for that service, and that was a very long process, a very difficult process for a single provider to do. But now DMAS is recognizing the Board of Medicine license. So note that currently the fee for this service, hourly, the fee for the licensed behavior analyst and assistant behavior analyst, and as well as the behavioral technician who's working under those people, is actually the same hourly rate. Now, of course, the care of the client is the ultimate responsibility of the licensed person. And to apply for this, you can look at Virginia ABA, oh, I'm sorry, that's incorrect. It's virginiaaba.org, O-R-G, or email admin@virginiaaba.org. Another lesser-known funding source is FAPT through CSA. Now, FAPT stands for Family Assessment Planning Team, which makes determinations for CSA, or the Comprehensive Services Act funding. If you're interested in becoming a provider, you provide through each locality or county or city. Funding is generally requested by DSS, or a Department of Social Services worker. To learn more about this, you can contact DSS, or you can contact the different localities. Now, before I talk a very little bit about school contracts, which is another funding source in Virginia, I do want to mention that there are changes in the works for Part C, or infant toddler services through the schools. The regulations are changing to allow LBAs to become providers similar to speech therapists and OTs, etc. Now, these services use the coach model rather than working one-on-one with the infant or toddler. It's more coaching the parent or caregiver. Now, VABA is going to be putting out more information on this development as it unfolds. But in addition to Part C, some schools or even parents might contact behavior analysts to perform independent evaluations in the schools when there's a particularly challenging problems. There's a book that may be a good resource for people who perform this service called Behavior Analytic Consultation to Schools. If you're interested in providing this service, you should contact the school systems directly and see if you can be added to a list of approved providers. Thank you for your patience in listening to this lengthy presentation about being a behavior analyst in Virginia. And I wanted to leave you with a list of resources that I'm going to present now. So for general resources, probably every behavior analyst knows the BACB.com, which is the website for the credentialing body. It's going to include all sorts of documents and things that you need, including the guidelines for health plan coverage of applied behavior analysis treatment for autism spectrum disorder. VCUautismcenter.org is also a great resource, which I'm sure you probably found as you've gotten this webinar that way. You can get technical assistance, professional development, and research. So other BCBA resources include virginiaaba.org, that's .org, and that's the Virginia Association for Behavior Analysis. And of course, I strongly urge that you become a member and take advantage of all the rights of being a member. And that's some resources that we apply. APBAHome.net is the website for the Association for Professional Behavior Analysts, and this is kind of the professional arm of the VACB. They can give you much more guidance on being a BCBA in Virginia and on having a practice. Their conference is coming up next year. It's going to be in DC, so very close to us here in Virginia. Some legislative resources. The Virginia General Assembly Legislative Information System is really great. It's so easily searchable, and you can type in keywords like autism or behavior, and you can come up with all the different laws that apply to that. You can search by delegate or senator, and you can search by session. It's a great resource, and it leads you directly to what's written in the Code of Virginia so that you know what the laws say. Now, for the regulations for behavior analysts under the Board of Medicine, and I strongly urge you to become familiar with these regulations as a licensed behavior analyst. That's going to be at dhp.virginia.gov/medicine. On the site, you can also look up to see who is licensed. You can look yourself up. You can renew, you can apply, you can see when the advisory board meets. And pretty soon there'll be some information on autism spectrum disorders and providers and diagnosis of that for those who are licensed. That will be in July of 2015. Here's some advocacy resources. Now, in addition to VABA, which does do some advocacy, these organizations are set up specifically for advocacy. There's first the Virginia Autism Project, which was really started by a group of parents, and it's a grassroots organization of families who are affected by autism. And Autism Speaks is also very active in legislation. And if you sign up on one or both of these lists, then you will be included on what's going on with respect to these laws. Now, for insurance resources, there's the United Healthcare Children's Foundation, and that's going to provide a grant that can cover copays for children up to 16. But if you're looking specifically about insurance, and if you need to make a complaint, or if a parent needs to make a complaint, you can go to the Virginia Bureau of Insurance. That information is listed here. Some other funding resources for parents that you may want to pass along. Beacontree.org provides funding for families as funding allows. The ARC of VA does not provide funding, but they know all about the different resources that are out there. So I definitely would send parents and caregivers to this site if they're looking for ways to pay for ABA. The Autism Society also is very active in many places, and they have regional groups as well, and they can provide information on funding sources. And finally, the National Alliance on Mental Illness can provide information. So if you have any questions, please feel free to contact me. This is my contact information, and I thank you for your patience. I hope you found this webinar to be informative and helpful, and I wish you the best in your endeavors.